The U.S. Department of Health and Human Services says the COVID-19 public health emergency is no longer considered an emergency.
At the end of the day, on May 11th, the federal agency plans to end the health emergency. As John Chapman reports, the agency still believes COVID-19 remains a public health priority.
The Douglas County Health Director tells us the end of the COVID-19 public health emergency doesn't mean the pandemic is over.
COVID is certainly still alive and well and spreading throughout every community.
The end of the emergency does mean fewer federal dollars will make their way to the state and local levels. And without those resources, things like free COVID testing kits will no longer be free.
We do have a handful that are still available here at the health department. There are likely still a few available at area libraries, but once that supply is exhausted, unfortunately, it's gone, and it will really, be up to healthcare providers and local pharmacies to be supplying those, and again, those may be at a cost.
Pharmacies will have to pay for COVID vaccine once the public health emergency comes to an end. David Cole of Cole's Pharmacy says some people could be stuck with a copay, but the great majority of people will be covered 100% by their insurance.
Medicaid also will be paying 100%. People who will be left out will the people that are uninsured. Because as of today, if they're uninsured, we would just administer it at no charge. But since pharmacies will have to pay for the cost of goods, then the people uninsured would have to pay for the vaccine.
Douglas County Health Director Dr. Lindsay Hughes says it is probably time to end the public health emergency because COVID cases and deaths have decreased because of the availability of vaccines and increased immunities.
This was something that I'm sure was very well, thought out. The consideration for when this was going to start to happen. They've given at least a bit of time for people to plan, so we're grateful for that. The pandemic, while certainly COVID is still ongoing, we're going to be living with it in the long term. There is a point at which we do have to kind of draw down. It's not the kind of response work that we can maintain indefinitely for decades.
On your side in Omaha, I'm John Chapman, 6 News.
Dr. Hughes says the end of the emergency could also mean reporting on things like transmission levels in the community may change over the coming months. And that could be a concern for healthcare institutions that use that information. And for more information on the end of the COVID-19 public health emergency, we've got links on this story. You can find them on our website, WOWT.com.